Hello, welcome everybody to another episode of Clinical Encounters. Today, we are going to discuss a very pertinent question. If not clinical, it is more like a career choice of medical students. That is regarding psychiatry as a career. To discuss that with me, I have got a colleague, a guest, a new guest, I would say, with me, Dr. Mohtasim. Welcome.
Thank you.
Dr. Mohtasim is a consultant. He has joined us recently. Out of all interest, he takes a special interest in teaching medical students. So hopefully it will be more meaningful. And let me do a quick disclaimer before we proceed. All that we're going to say is primarily educational nature. If you have got some specific clinical questions, you must see a qualified physician or a psychiatrist. So, once again, Dr. Mohtasim, as I discussed, choosing psychiatry as a career is a contentious issue, as you have seen. Many times people falter, they take multiple opinions before taking psychiatry as a career. Possibly, I understand, possibly that could be because of the bad press the psychiatry has got, which is quite unfortunate, we all know that.
Yeah.
Do you agree with that statement?
First of all, thanks for inviting me. It's an honor to be part of this clinical encounter, which is a fantastic initiative by yourself.
Thank you.
Coming to the question of choosing psychiatry as a career, I think I completely agree. There's a lot of negative promotion of psychiatry in the media, which has historically it's always been like that.
Mm-hmm.
There's quite a few myths about psychiatry. One is patients with psychiatric mental illness don't get better, which is completely false, as we all know. There's a lot of evidence to back our treatments. The other myth is people who work in psychiatry also become like patients, become mentally unwell, which is completely, again, another myth. The third, I think, is people believe that once you get trained as psychiatry, you lose your medical skills, which is not the case. In fact, you're having two specialties. You're a proper doctor in the first place. Also, you have some specialty of having psychiatry as well. So I think you're not only the doctor of the body, you're doctor of body plus mind, which is something extra. So I think there are a few myths which have been floating around, and people, my trainees, medical students, get surprised when they are placed with me for a week to see these myths being dispelled, really. Another myth, which is the patients are very aggressive and violent, which is not the case as well. We all know the violence is much less compared to the patient presenting in A&E, for example. So these are the few myths which.
Thank you. I think this is really important that we are fighting against myths.
Exactly.
And against not the reality.
Exactly.
A large credit or discredit can go to media.
Exactly.
The way psychiatry is being portrayed.
Exactly.
Where popularly people believe that psychiatry is something esoteric. It's not scientific.
Exactly.
And it is something which people are a bit scared of. So that is obviously reflected among the medical students. And what I have found out is that, as you told very nicely, when medical students in the prime of their career choice, when we orient them properly, they take up, they're more likely to take up psychiatry as their career. I have also plenty of experiences, I must say, in that similar line. I have seen people coming with a very negativistic attitude about psychiatry, and then after explanation, after discussion with them over a period of time, many people have chosen psychiatry as their career. I was pleasantly surprised, at least one of the group of medical students, when we did a survey about their attitude towards psychiatry before the traineeship and at the end. So there was a good changes. I'm pretty sure there are a lot of studies done elsewhere as well.
Just to add to that about the attitudes before and after. In Royal in UK, the statistics shows that those who have done foundation training, have placement in psychiatry, are more likely to choose psychiatry as a career, even if the psychiatry was not their interest in the first place. So there is, once they are exposed to the specialty, the chances are higher that they accept. The other example is trainees who do GP training. GP is a training scheme.
Family physicians.
Yeah, as family physician. When they have placement in psychiatry, the chances of them moving from GP to psychiatry is quite high as well. So these are the statistics. And also, like I said, any positive, good quality experience in psychiatry, the chances that they'll choose psychiatry as a career is quite high. So,
I mean, that's what I'll just give a specific example. I was going to give that time. I remember a group of medical students came for training. And they inherited this view from their predecessors who had come, that, well, you go there, they teach psychiatry in a very haphazard way, so you don't learn anything. So that had added to their already skewed attitude about psychiatry. So once they came and they saw some of these young, quite enthusiastic teachers, they are pleasantly surprised. And we are also surprised at the end of their training, they gave a very good feedback.
Exactly.
So a lot, what I wanted to, my point is that a lot depends upon us, the clinicians, the way we deal with individual medical students. Our attitude towards psychiatry is reflected in their belief system. We are doing a big job, a very responsible job when you are taking medical students. You have to be really careful about the things that you talk to them. I believe it is very important not to give them too many complicated cases just to confuse them.
I think the idea is to give them a very positive, enjoyable experience in
Exactly.
psychiatry. And at the end of the day, the chances that they'll take psychiatry is quite high. For me, my personal journey, why I took psychiatry was my placement in psychiatry during my medical school. I was really fascinated by an excellent professor in my medical college. His style of teaching, the way he connected with the patients, the way the patients trusted him and it got better, I was really fascinated by that. So I think if you do a survey of all the psychiatrists, most of them will have this kind of experience of their placement in psychiatry. So the point is, I completely agree. It's our responsibility to make sure that we provide a conducive environment for learning and teaching. And learning and teaching is part and parcel of every clinician. It shouldn't be certain group of individuals.
Absolutely. And also in the same light, most of the colleges, Royal College of Psychiatry, Australian College of American Psychiatric Association, they have got special sections dedicated for medical student teaching and career choice. Excellent material is available, both written, textual, as well as audiovisual material, highlighting these points. So you're all very welcome to go to those sites and look at the promotional material, but they also give very pertinent information about how to choose psychiatry as a career. So a lot of the so-called myths would be dispelled.
Yes, completely agree with you. Royal College is running a campaign on choosing psychiatry, and they've got an excellent page with a lot of videos for you to see as well.
Okay, So today our aim was basically to touch upon this area, that psychiatry as a career, the challenges, and what can be done both as a clinician and as medical students. So our advice is that you be open, you look at all the pros and cons, don't be dissuaded by bad press, which our branch has unfortunately got. So having said that, it's at the end of the day, it's you who will be making the call. So best wishes for your future career, and if you want to know more, as we said, you are always welcome to go to the college websites to know about psychiatry as a career. So until next episode.
Thank you, Dr. Subhash, for having me. It's been a fantastic experience. I wish you all the best.
So thank you so much. So until next episode, have a nice day.